Hello everyone, welcome to my channel. Today I have come with some important clinical points regarding shoulder joint. So without wasting further time, let's go through that. Rotator cuff is an important structure that belongs to shoulder joint. The muscles comprising rotator cuff includes supraspinatus, infraspinatus, teres minor, and subscapularis. An easy way to remember these muscles is by remembering the mnemonic SITS. S for supraspinatus, I for infraspinatus, T for teres minor, and S for subscapularis. Important bursae belongs to shoulder joint includes subacromial bursa, subdeltoid bursa, subscapularis bursa, and infraspinatus bursa. Among these, subacromial bursa is the largest bursa in the human body, located at the shoulder, laying between the acromion, deltoid, and the rotator cuff tendons. Disorders of rotator cuff includes impingement syndrome or supraspinatus tendinitis, ruptures of rotator cuff, adhesive capsulitis, and calcific tendinitis. First one, impingement syndrome. It is a clinical syndrome which occurs when the tendons of the rotator cuff muscles, mainly supraspinatus, undergo repetitive compression or rubbing under the coracoacromial arch. This can result in pain, weakness, and loss of movement at the shoulder. Signs and symptoms include limited range of motion at the shoulder because of pain. A painful arc of movement may be present during forward elevation of the arm from 60 to 120 degree. A passive movement at the shoulder will also appear painful when a downward force is applied at the acromion, but the pain will cease once the downward force is removed. Next is adhesive capsulitis or frozen shoulder. It is because of contracted thickened joint capsule that seem to be drawn tightly around the humeral head with a relative absence of synovial fluid and chronic inflammatory changes within the subsynovial layer of the capsule. Next is calcific tendinitis. It is because of hypovascularity. It includes two phases. Phase 1, pre-calcification stage. It is due to fibrocartilaginous metaplasia. Phase 2, calcific stage. During this stage, calcium is deposited into matrix vesicles, which are excreted by the cells and coalesce into larger calcium deposits. This stage can be exceedingly painful, and many patients seek treatment at this time. Differential diagnosis in a case of painful shoulder includes referred pain syndrome due to spondylosis or mediastinal pathology, joint disorders like arthritis, bone lesions because of inflammations or tumors, rotator cuff disorder, instability because of dislocation or subluxation, nerve injury due to suprascapular nerve entrapment. During examination, the scapulohumeral rhythm is observed. If a painful arc, that is pain or inability to abduct because of pain, is observed at 45 to 120 degree angle, a subacromial impingement syndrome is suggested. If the pain is greater than 120 degree when the full elevation is reached, an acromioclavicular joint disorder is suggested. If a reverse scapulohumeral rhythm, that is an abduction initiated by the scapulothoracic joint rather than by the glenohumeral joint, is observed, a frozen shoulder is suggested.